My name is Robert Lawrence, and I have sex. What are my sexual fears? That I'll lose it. I've already lost it once. Losing it again would be really hard. People who become disabled, who have chronic pain like I do, our sexuality is changed radically. I have to time everything I do sexually to my medication schedule, to my physical behaviors. For example, I can walk 4 blocks. So if I walk 8 blocks and expect to go have sex, it's probably not going to work because my body just doesn't have the ability from the physical stress it's been on it. So I have to plan consciously for it. Initially, the first 7 years I was bereft. I'd lost my sex. I was constantly ill. I had no arousal. I had no libido. And all the sex education I did prior to being hacked up by people in hospitals and left with gangrene for a year. I love saying it that way, it's so lurid. All that stuff I had to learn. All the stuff I mouthed, such as, you can change your sexuality a little bit, you can adapt to things. People adapt through their lives. Our sexuality is a fluid structure. It isn't just this and that and this and that. It changes through our lives. Our partners change, our interests change. Our core interests usually stay pretty stable, but in time, because of physical changes as we're elderly, ask a 90-year-old what sex is. Some of them are sexually active, ask them. The silver lining is that I have learned very rapidly what our elders have learned in their 80s and 90s and hundreds per se, is that sexuality is an inherent part of how I exist in life, and that sex can be a glance, sex can be a touch on the hand, sex can be a conversation, sex can be being held. It isn't about a penis going into an orifice to squirt. That's not sex. Sex is everything that goes up to that. Sex is getting really aroused and then stopping and telling your partner, let's go shoe shopping. And then buying a really hot pair of shoes and going back and starting again.